Okay. Uh, Please raise your hand who would like to participate in the mock. At first, our first candidate is Dr. Badhan. Are you here, sister?
Yes, Bhaiya.
So, how's your preparation is going on?
Hello.
Yes, how's your preparation?
Hello.
Hello, can you hear me?
Bhaiya, not really good. Yes, Bhaiya, I can hear you now. Not really good, but I will try, Bhaiya.
Okay, no problem, sister. So, this is your first station. So, could you say me what is number 21?
Number 21 is posterior gluteal line.
Okay. Now tell me what is number 3
This is anterior gluteal line.
and what is number 12?
This is inferior gluteal line.
Okay, what is this thing?
This is the iliac crest.
Okay, what is 28?
This is the tubercle of iliac crest.
Okay, so what is number 23?
This is posterior superior iliac spine.
Number 22?
Posterior inferior iliac spine.
Number 5? Yeah, yes, it is 5. Hello.
Iliac spine.
Okay. Number 4? Hello, Dr. Badhan. I think you do have some problem
Iliac
with your net. I can't hear you properly, sister. So what is number 4?
Hello.
Yes, yes. What is number
Maya,
4?
that was anterior superior.
And
Oh, okay. This is anterior inferior iliac spine.
okay. So what is number 15?
This is the ischial tuberosity.
So tell me which bone is this?
This is the left-sided hip bone.
So now tell me why this is left-sided hip bone.
Because we know that the pubic symphysis, I mean the pubic tubercle, which will be directed medially, the acetabulum will be directed laterally, and the uh, uh, ischial tuberosity will face posteriorly.
But you have missed the most important thing. These are the most important thing you have to mention.
Okay.
Okay, okay, that's great. Now come to this picture. So could you tell me which muscle get originates from number 5?
Number 5 is gluteus maximus.
Okay, which muscle originates from number 6?
Gluteus medius.
Number 7?
Gluteus minimus.
Okay, could you tell me which muscle originates from number 10?
Number 10 is sartorius and inguinal ligament.
Okay, sartorius is the higher one, and this is sorry, sartorius is the lower one, and inguinal ligament from the higher one, right? So number 10 is inguinal ligament, and number 16 is for sartorius, right? Tell me, what is which muscle originates from number 19?
This is the straight head of rectus femoris.
So how many heads of rectus femoris?
There are two heads, a straight head and reflected head.
Now tell me the origin of the rectus femoris of different heads.
The straight head originates from the anterior inferior iliac spine, and the reflected head originates from the upper margin of acetabular rim.
Okay, that's great. Now tell me what is the attachment of number 9?
Number 9 is iliofemoral ligament.
Okay, okay, very good. Now tell me what is the attachment of number 13?
This is the piriformis muscles attachment.
Okay, tell me the origin of the piriformis muscle, from where it originates.
Okay, the piriformis muscle originates from sciatic, the border of sciatic notch and the posterior inferior iliac spine.
Mm-hmm. Any other attachment? Most important attachment of piriformis?
Mm, okay, the anterior surface of the sacrum.
Exactly, this is the only one. So if you would like to mention anything regarding the origin of the piriformis, and that is the anterior sacrum. Did you get my point? If you would like to answer
Yes.
anything more, that's okay, but you will have to always mention the anterior sacrum. Dr. Manarat, did you get my point there? Dr. Manarat?
Okay.
Yes, sir.
Okay, that's good. Now tell me, what is which muscle origins from number 17
Semimembranosus,
and number 18?
semitendinosus, and long head of biceps femoris.
Okay, and number 3?
This is for adductor magnus.
Number 3 is for erect muscle. That's good. Okay, now come to this picture. Could you tell me what is number A?
Number A is gluteus maximus.
Okay. What is number B?
Number B is gluteus medius
Is it sister? Is it doctor?
uh, or gluteus. Number B is piriformis. Sorry,
Oh,
piriformis.
okay. You won't get the second chance if you tell is the gluteus medius or something else. So always look for the shape and the nerves are related with this muscle. Did you get my point? Now tell me what is the inserting point
Yes.
of piriformis?
The insertion of piriformis. It is in the greater trochanter of femur.
Okay. Now tell me what is number C?
Number C is the sciatic nerve.
Okay. What is okay? Now tell me the surface marking of the sciatic nerve.
Okay, the sciatic nerve forms by drawing a curved line between 2 points. So the first point is the
Mm-hmm. Yeah.
between the posterior superior iliac spine and ischial artery, and the between the
I think we
and
do
we
have some network issues.
join
Please,
the
please
points
repeat
line
again.
and that.
Please repeat again. You do have some network issue.
Okay, Bhaiya, I will draw a curved line between 2 points. The first
Mhm.
point is halfway between posterior superior iliac spine and ischial tuberosity, and the second point is the halfway between greater trochanter and ischial tuberosity.
Okay, that's great. Now come to this picture. Now rapid revision. Now tell me what is number 11.
Number 11 is the piriformis muscle.
Okay, so could you tell me what is number 17 and number 18?
These are superior gluteal artery and superior gluteal vein.
Okay, so what is number 7 and
Number seven is
6 or 7?
number seven. Okay, number 6 is inferior gluteal artery, and number 7 is inferior gluteal vein.
Okay, what is number 15?
Number 15 is the sciatic nerve.
Okay, now tell me the root value of sciatic nerve.
It is L4, L5, S1, S2, S3.
Okay, now tell me what is number 1.
Number 1 is a gluteus maximus.
Okay, now tell me the inserting point of the gluteus maximus.
The inserting point is there are 2 points of insertion. One is the gluteal tuberosity of femur, and another is one is the iliotibial tract.
Okay, so now tell me the origin and insertion of the iliotibial tract.
The origin of iliotibial tract is from the anterior iliac crest, and the insertion is in the lateral condyle of the tibia.
Okay, what is the function of the iliotibial tract?
The function is it stabilizes the knee while extension and mid flexion.
Okay, this is good. So, what are the other muscle that inserts into the iliotibial tract? What is the other muscle?
There are two muscles. There are two muscles that insert in the iliotibial tract. One is gluteus maximus, and the another is a tensor fascia lata.
Okay, this is good, very good. Now tell me, what is number 2?
Number 2 is gluteus medius.
Okay, so now come to this picture. So what is number 3?
Number 3 is gluteus minimus.
Okay, now tell me the insertion of the gluteus medius and minimus.
Gluteus medius and minimus insert into the greater trochanter of femur.
Okay, so what is the function of the gluteus medius and minimus?
The main function is they abduct the femur in the hip joint, and then they do the medial rotation. And again, the another function is when one leg is in the air, they stabilize the pelvis by preventing it from dropping to the opposite side.
Okay, so which nerve supplies the gluteus maximus, and which nerve supplies
Gluteus
the
maximus,
exactly?
maximus is inferior gluteal nerve.
Okay, which nerve supplies the gluteus medius and minimus?
Superior gluteal nerve.
Okay, now tell me the root value of the inferior gluteal nerve and the superior gluteal nerve.
Root value inferior gluteal nerve is L5 S1 S2, and
Okay.
superior is L4 5 S1.
Very good, very good. I'm impressed. Okay, so what was the nerve supply of the gluteus medius and minimus?
Superior gluteal nerve.
Okay, now the nerve have been injured. So what will you get?
I will get Trendelenburg gait, and the Trendelenburg test will be positive.
So what is really? What is the condition will develop?
So when one leg is up in the air, the pelvis will drop to the opposite side of the affected part.
Okay, that's great. So what are the other conditions when Trendelenburg gait happens?
There are like the abductor muscle weakness or the weakness in tendon of the abductor muscle, L5 radiculopathy, stroke, myasthenia gravis, and I can remember all these.
Okay, no
Now.
problem. You didn't mention about the trauma, DDH, painful hip,
Yeah,
so many
okay,
things.
yes.
So
Trauma and
that
pelvis.
exactly. So that ends our first station, and I'm really impressed on Dr. Badhan. You are really doing very well. You didn't miss any question. You are
Thank you,
doing
Bhaiya.
very well. Just keep continuing your
Thank you.
preparation like this way, and definitely I can assure you will pass in the exam in the very first attempt, inshallah. Okay, that's good. So who was the second candidate? I think that's the Dr. Alamin Bhai. Guys who would like to participate,
Okay, yes.
please raise your hand, please. Would like to participate in the mock. So that this was our first. So these pictures are new. You can take some screenshot so that you can practice. So, Dr. Alamin Bhai, this is your station.
Yes.
Okay.
Okay.
So tell me, what is number? I think it's the 19.
This is sartorius.
Okay. Now tell me, what is the origin of the sartorius?
Anterior superior iliac spine.
Okay.
Origin is from the anterior superior iliac spine.
Okay. And insertion?
Insertion is a medial pes and serenus.
Okay. Okay, that's great. Could you tell me what is number 26?
Iliotibial tract.
Okay. So now tell me the attachment of iliotibial tract again. We do have some noise.
Insertion from Insertion from the
Origin first, then
iliac.
insertion.
Okay, origin from the iliac crest at iliac tubercle, and insertions a lateral tubercle of tibia, lateral condyle of tibia.
Exactly, lateral condyle of tibia. Now tell me what is number 17.
Rectus femoris muscle.
Okay, now tell me the origin of the rectus femoris and insertion of the rectus femoris.
Origin from anterior inferior iliac spine, and a straight head and reflect head from the upper rim of the acetylbulum, and insertion is on the tibial tuberosity.
Okay.
Tibial tuberosity.
Okay, what are the quadriceps femoris muscle?
Okay. Vastus medialis, vastus lateralis, vastus intermedius, and biceps rectus femoris.
Okay, now tell me what is 28?
The gracilis.
Is it, Bhaiya? Gracilis lies laterally
No,
by this way?
No. Sorry. This is.
If it is gracilis, what about the 9?
Yes, 9 is gracilis.
Okay, that's great. So what is 28? This is the rectus femoris. Is there anyone who would like to help Dr. Alawin Bhai?
Vastus lateralis.
Lateralis. Oh, yes.
Okay,
Lateralis.
that's great. Okay, I have decided not to answer. You guys will answer. We are participate or help the other guys. No problem. So this is vastus lateralis. So that was rectus femoris. So Dr. Alawin, could you tell me what is 29? Hello.
29. Okay. This is vastus medialis.
Okay. So tell me what is the inserting point of this muscle?
Inserting point is a tibial tuberosity of tibia.
Any other in a perfect way?
Medial surface of patella.
Of whole 3 muscle, medial surface of patella, Bhaiya?
No, vastus medialis is actually.
Just tell me what is the insertion of all these 4 muscles.
Vastus medialis is the
patellar tendon.
Exactly, patellar tendon. Medius lies medially, lateral is lateral way, and just answer, please.
Okay, the vastus medialis is inserted on the patellar tendon, and ultimately to the tibial tuberosity of tibia.
Okay, that's good. Now tell me what is this structure, and I think this is 10. What is 10?
This is a long saphenous vein.
Okay, so could you tell me where's long saphenous vein drains?
Okay, drain in the saphenous opening of the femoral vein.
Okay, so could you tell me what is number 6?
This is what is the 6? Okay, the femoral artery.
What is number? I think it is 7.
Femoral nerve.
Okay, now tell me about femoral triangle. How femoral triangle is formed?
Okay, the superiorly is formed by inguinal ligament, laterally is formed by sartorius, and medially is formed by adductor longus.
Okay, now tell me the floor of the femoral triangle.
Floor is formed by adductor longus and adductor magnus.
So what is the
adductor
content
longus
of
and adductor magnus?
Tell me the
contents include. Okay, contents includes femoral nerve, femoral vein, femoral artery.
Okay.
And lymph nodes and superficial and deep inguinal lymph nodes.
Okay, tell me about the femoral sheath. What is femoral sheath?
the fibrous sheath is the upper 1 inch of the femoral vessels.
Okay, so what is femoral canal?
The medial part of the femoral sheath is the potential space. It's called femoral canal.
Okay, so could you tell me what is femoral ring?
It's opening, the upper opening of the femoral sheath.
Okay, so tell me the boundaries of the femoral ring.
Boundary upper part, anteriorly femoral, anteriorly inguinal ligament,
Mhm.
medially femoral vein, and laterally lacunar ligament.
Is it Bhaiya?
Lateral,
Just try to remember
sorry, laterally
IPL.
femoral vein.
IPL.
Okay,
Just try to remember IPL. Anteriorly inguinal ligament,
inguinal
then
ligament,
posteriorly pectineal ligament, and
pectineal
medially
ligament.
lacunar ligament. And you already know that lateral lies femoral vein. So these are the mnemonics. Okay, now tell me what is the importance of the femoral canal, inguinal canal.
Okay, it is potential space for femoral hernia, and
Exactly.
it helps for space expansion during the venous pressure rise. During the venous pressure rise, then it creates the expansion. It gives the expansion space, and it is a potential space for femoral hernia and the femoral.
That's enough.
Lymph
No,
nodes.
you don't need to mention anything more. That's enough. You're perfect. So, is there anyone who could mention about the floor of the femoral triangle? Please correct us. So, the floor of the femoral triangle.
Adductor longus, iliacus, and pectineus.
Iliopsoas, I think. Huh? Iliopsoas,
Yes.
pectineus, and adductor longus. Right. Did you get the point, Dr. Alwin bhai?
Yes.
Okay. Now come to this picture. Could you tell me what is number A? What is number A? What is number A?
Okay, this is sartorius.
Okay. Now tell me the nerve supply of the sartorius.
Sartorius number 2, number 3.
I didn't get you, Bhaiya.
Number 2, number 3.
Okay, what is the name of the nerve? Someone please help.
Femoral
me.
nerve.
Someone
Femoral
please.
nerve.
Exactly. Okay. So could you tell me the function of the sartorius?
Okay. Extensions of the knee joint and flexions of the hip joint.
So what is number B?
This is femoral. This is B. Okay. This is femoral vein.
Is it? So what did I say about the identification of the nerve and other vessels?
Oh, sorry. This is femoral nerve.
So tell me, how would you identify these things? How would you identify nerve? How the veins?
Nerves with branches.
Exactly. So whenever
and
you are
veins
getting
thin. Okay.
So in
the
the
nerves with branches.
Okay, just let me say, in the cadaveric picture, you will get the nerve, any structure that will have several branches like this way, and that is nothing but nerve. And cadaveric picture, any structure that is blackish, almost blackish, because identification of these structures together is very difficult. And that is, if any blackish structure, tubular blackish structure, and that is nothing but vein. And any broad structure and thick and shiny structure, that is artery, right? So apply this theory here. So what is number B?
Okay. Number B is the femoral nerve.
Okay. What is number E?
This is saphenous vein. Great saphenous vein.
Great saphenous vein. What is number C?
This is femoral artery.
Okay, so what is number D?
This is a deep femoral artery, deep branch of the femoral artery, profound
Okay.
femoral artery.
So what is this one?
This is superficial femoral artery.
And what is F? You already mentioned about the femoral
This is
triangle.
gracilis.
Is it Bhaiya?
No,
Is
no, no,
it
adductor longus. Sorry, adductor longus.
adductor longus? Okay. Okay. Okay, adductor longus. Adductor longus. That's great. There's some noise in from other side. So that is the adductor longus muscle. That's good. So, Dr. Alamin bhai, could you tell me again? I think it would be easier for you to identify. Just tell me what is this structure, Dr. Alamin bhai? What is this? You have been muted. Hello, could you hear me, guys?
Yes, Bhaiya.
Yes, Bhaiya.
Okay, someone say
Yes, Bhaiya.
what is this?
Inguinal ligament.
Inguinal ligament.
Okay, what is this? Anyone,
Great
please?
Stefan.
Superficial
Stephanus vein.
femoral.
Gets Stephanus vein.
Great saphenous vein. So now tell me the course of the great saphenous vein, from where it originates and drains.
It starts
Dr.
from the
Anaba, please
medial,
continue.
It starts from the
the dorsal venous arch, and then
Laterally?
the medial
Laterally?
marginal vein.
Exactly.
Medially, bhai, I was coming to
Exactly.
that.
Okay.
The dorsal marginal vein actually converges with the medial marginal vein on the medial side. Then it passes medial to in the medial malleolus and ascends straight with a slightly curved course in the knee joint. Then it again ascends straight and then drains into the femoral vein.
Okay, that's good. That's good. Now tell me the course of the short saphenous vein.
Short saphenous vein starts from the lateral side of the foot by joining of the dorsal digital vein with the lateral marginal vein together, and then they go behind the lateral malleolus and ascend straight, and then in the knee joint it directly drains into the popliteal vein.
Okay, in the popliteal fossa.
Yes.
Right. Okay. Again, another picture of the same region. Quick, just tell me very quickly, what is number 21?
Now 21 is the sartorius.
Okay, what is number 13?
Oh, sorry, Bhaiya. I thought you were asking me.
Please continue, Dr. Anaba. Dr. Anaba, please continue. What is 21?
Which?
This one.
21 is the sartorius.
Okay, what is number 13?
13 is the lateral cutaneous nerve of the thigh.
Very good. So what is number 26?
26.
Is the
could you
skin?
please?
Is the skin, and it has been reflected, and is the medial aspect, and is the lateral aspect of the thigh, upper thigh. So now tell me, what is 26?
Is this the iliotibial tract?
This is the iliotibial tract. So now tell me, what is this? Someone.
Tensor
Exactly. This is a tensor fascia lata. This originates from anterior of this tract and inserts this way, and from behind another muscle inserts here. And what is this?
Gluteus maximus.
Gluteus maximus. Very good. Now tell me, what is number 8?
Could you please magnify the image? I'm actually doing my classes from the hospital, and I'm doing my class in the phone.
From if I magnify, you won't able to identify, I think. What is number 8?
This is the femoral vein.
Okay. So what is number 6?
femoral artery.
Okay. So what is number 7? This one.
This is the femoral nerve.
Okay. Okay. I think we have covered everything from this picture in the previous one. Now tell me, what is Hunter's canal or subsarterial canal?
Yes, Phil?
What
Could you
is
please repeat the question?
what is Hunter's canal or adductor canal or subsarterial canal?
Hunter's canal is or subsartorial canal is a canal which runs from the apex of the femoral triangle to the popliteal fossa.
Okay. Could you tell me the boundaries of the adductor canal?
Yes, laterally it has the vastus medialis muscle. Posteriorly it has two muscles with adductor longus above and adductor magnus below, and roof is formed by the sartorius muscle.
Okay. So tell me what are the content of subsarterial canal?
It contains a superficial femoral artery with femoral vein, saphenous nerve, and nerve to the vastus medialis.
Okay, very good.
And
Now,
two branches of obturator nerve.
I didn't
There are
get
two
you.
branches of obturator nerve.
Okay, you can mention
Yes,
that.
as far as I remember, there was this
Okay.
two nerve mentioned in the picture.
Okay, so what is this one? Which muscle this one?
This is the sartorius muscle.
Okay, so this is the sartorius. So what is this one?
This is the vastus medialis.
Vastus medialis. So tell me which structure this one?
This is the femoral artery.
Femoral artery. Exactly. So tell me, you don't need to mention anything more. So this is the canal, right? This is the canal.
Yes.
Right. Very good. So now come to this picture again. Correct picture. So tell me, what is number 5? 5 is here.
Which one is number?
I have marked. This is the 5. Now the 5, basically this muscle. Just tell me what this muscle is.
The vastus medialis.
What is number 13?
13 is the sartorius.
Okay. So what is number 3?
3 is the gracilis.
Okay, very good. Very good. You don't need to see anything from this picture. Okay. Could you tell me what is the which picture is this?
Which one here?
This one. Whole. What is this?
Number A.
No, as a whole, what is the pictogram?
Angiogram of the lower limb arteries.
Okay, angiogram. Not, you don't mention the arteries. Angiogram means the
Okay.
vessels, right? So what is number A?
Okay. Number A is the common femoral artery.
Femoral artery, right? So what is number C?
C is the superficial femoral artery.
Okay, so what is this one?
This is the profunda femoris.
Deep femoral
or the
artery,
deep femoral
right?
artery.
Okay, that's great. So now tell me, what is this one? Number B?
This is the lateral circumflex femoral artery.
Now tell me, from where lateral circumflex femoral artery arises?
It arises from the profunda femoris artery.
Okay, any other branches of the profunda femoral arteries?
Yes, profunda femoris have medial circumflex femoral artery, 4 perforators,
And any other branches?
and I don't remember. There is, but I
Okay,
don't remember the
these are
name.
the main important branches. Okay, so what is number D? Very rapidly.
Number 3 is the profunda femoris.
Okay, no problem. Okay, tell me about this picture. Could you tell me what is this one?
This is the popliteal artery.
Popliteal artery, right? So what is this one?
Which one?
Please continue.
The posterior tibial artery.
Is it, sister? What did I say yesterday?
No. This is the anterior tibial artery.
Is it? So what is this? What is
Yeah.
this? And
It's
what
very
is
tough
this?
for me to actually see the picture.
Okay, someone please help Dr. Annaba. Is there anyone who would like to help?
Tibioperoneal trunk.
Okay, who is it? Dr. DS. So this is tibio-peroneal. Sorry,
Peroneal.
tibio-peroneal trunk. Right. So what is this, Dr. DS? What is this?
Which one we have?
This
Sorry, I
one.
can't see any mark.
This one. This one.
That's the anterior tibial.
Very good. Very good. So what is this one?
Peroneal artery.
Which peroneal? Which peroneal? Aren't you getting me? Is there any problem with
That's
that?
the peroneal artery.
Which peroneal, doctor?
Which side you mean?
This one. This one. This one.
Is that the posterior tibial?
Exactly.
Posterior tibial.
Exactly. So which artery is this?
That's the peroneal then.
Which peroneal? These are all peroneals. This is a peroneal, this is a peroneal, and this is also peroneal. So you are not allowed to say only the peroneal. So they do have some different names. Who would
One
like
is
to?
anterior tibial, one
Yes,
is posterior
yes,
tibial.
yes.
And
This is the
third one is peroneal.
yes, exactly. Peroneal arteries. My bad. Okay, this is the anterior tibial, and this one posterior tibial, and this is the peroneal artery, right? In between anterior and
Peroneal.
posterior.
Okay.
Okay, I think and this is okay. Now tell me, what is this? Which vessel is this?
The
Look at the
popliteal
location.
artery?
Exactly, this is the location. That's why it is the popliteal artery.
Popliteal.
Okay, that's good. Okay, who was the next candidate? I think guys who would like to participate, please raise your hand. Dr. Nahida, are you here? Dr. Manarat, are you here?
Yes, bhaiya.
Yes. This you.
Yeah, I am here.
So you didn't raise your hand. Why? I asked you to raise your hand. Okay, you are the next candidate.
Because
So
I can
Bhaiya, there is mama
how
ring
much time I ask you.
beside me. That's right.
okay, no problem. This is
Around me,
the
there are some mama.
okay. This is Dr. Manar's station. Bhai, could you tell me which bone this one? Dr. Manar,
Yes, bhaiya.
tell me which bone this one?
This is the femur, the left femur.
Okay, tell me why this is the left femur.
Because head is
It is
situated
basically
upward.
not the as a whole the femur, is the proximal end of femur, right? Of the left femur, proximal
Yes.
end of left femur, right? There's no, it's not the complete bone. So it's the proximal head of right femur. Now tell me what is the right sided?
Sorry, bhaiya.
Why it is the right left sided? You mentioned that it is the left
Yes,
sided.
left sided. Yes.
So why it is left sided?
Yes. Because the laser trochanter is posteriorly.
Lies posteriorly
The
and
head is
medially.
upward. Yes, posterior medially. The
Mhm.
head is upward and medially, and there is posteriorly present the intertrochanteric crest.
Okay, this is the intertrochanteric crest. Okay. And greater trochanter lies which side this is?
Anteriorly, medially actually.
Outward and lateral.
Is the medial? So what is this?
Sorry, laterally.
Laterally.
Outward
Sorry,
and
lateral.
laterally.
Okay. Now tell me what is number 4?
Number 4 is head of femur.
Okay, what is number 8?
Laser trochanter of femur.
Number 11?
Number 11 is neck.
Okay, what is number 3?
Number 3 is greater trochanter.
What is number 5?
Number 5 is intertrochanteric crest.
Okay, and number 14.
A trochanteric fossa.
Now come to this picture. What is number 3?
Number 3 is greater trochanter.
So number 6.
Number 6. It's intertrochanteric line.
Exactly. So what is number 11?
Number 7, bhaiya.
Sorry, this one number 7. And number 7.
It's maybe lateral condyle, maybe.
Exactly.
Sorry.
Lateral condyle, the lower end. So what is number 10?
Number 10 is medial condyle.
Okay, and number 1? Is there who would
Sorry,
like to help? Would like to help? What is number 1? Is the
Epicondyle.
Adductor tubercle.
adductor tubercle. Right. Okay, Dr. Manarat, could you help me? Could you say me what are the attachment of the greater? What is this? Greater trochanter. Could you tell me what is the attachment of the greater trochanter? Dr. Manarat, are you here? Guys, can you hear me? Dr. Nahida, please
Yes,
continue.
yeah.
Dr.
Yes,
Nahida,
sir.
please continue. What is the attachment of the greater trochanter?
Hello, bhaiya. Hello.
Yes, you do have some issues with the net. Please
Yes,
solve this issue.
I'm actually shifting my house because I'm totally, there is no light also.
Okay, just solve these issues and then we'll continue with another station. No problem. Just solve the issue first. Dr. Nahida, could you tell me what is the attachment of the number 3 or greater trochanter?
Greater trochanter get insertion of 3 muscle, gluteus medius, gluteus minimus, and piriformis muscle.
Okay, could you tell me what is number 8?
Laser trochanter.
Okay, laser trochanter. So could you tell me which muscle inserts here?
Iliopsoas muscle.
Okay, now tell me the origin of the iliopsoas muscle.
Okay, psoas major muscle originates from, it has 2 heads, superficial fiber and deep fiber. Superficial fiber arises from the body of lumbar 2, 3, 4, and deep fibers are arise from the transverse process of the same vertebra.
Same vertebra? Is it? Okay, deep fiber arises from the transverse process of lumbar 1 to lumbar 4, and superficial
Lumbar
fiber
1 to lumbar
originates from thoracic 12 to lumbar
12 to
lumbar 4.
number
4
4.
to lumbar 4 with intervertebral disc.
Exactly, body and intervertebral discs. So then it
Body
continues.
and inter.
And origin of the iliacus?
Iliacus arises from the iliac fossa.
Okay, then how those muscle continues downwards?
Continues downwards as iliopsoas muscle, and it is comes it descends just below the inguinal ligament.
Exactly, they'll keep asking you until you say that goes below the inguinal ligament. Then it
Inguinal.
inserts into the lesser trochanter. So now tell me the
Lesser
function of the
trochanter.
psoas major muscle. Before function, tell me the nerve server of the psoas major muscle.
Psoas major muscle. I can't remember this right now.
Is there anyone who would like to help, Dr.
Femoral nerve.
Okay, tell me the function of the psoas major muscle.
Psoas major muscle, it causes flexion of the hip joint.
And any other function?
Flexion of hip joint and medial rotation. Medial rotation and flexion of hip joint.
Is it medial rotation? What did I say yesterday in the class? Is there anyone who would like to help about the function?
Lateral rotation.
Lateral rotation or external rotation of the hip joint?
External
Right.
rotation.
external rotation or lateral rotation, that's okay. So Dr. Nahida, tell me what is number C? What is number C?
Number C is biceps, long head of biceps.
Okay, this is the long head of biceps. You didn't finish your answer. This is the long head of biceps, brachii.
Biceps femoris. Biceps
Okay.
femoris.
Okay.
Biceps femoris.
Okay, just complete the answer. This is the long head of biceps femoris. Okay, tell me what is number A?
Number A is semimembranosus.
Okay, so what is number B?
Semitendinosus.
Okay, and what is number D? Number D.
This is also number D, biceps femoris.
Is it? What did I say? Where biceps femoris lies? Just deep to this structure. So deep to this structure, and the lateral most structure is the vastus lateralis. So this is the vastus lateralis. So tell me about the hamstring muscle. Tell me the origin of the hamstring muscle individually. What are the heads of the biceps femoris muscle and their
Biceps
insertion?
femoris has two heads, straight head and long head. Straight head arises from
Is it
straight head arises from
straight
the
head or something else?
a long head and
Long and short.
Exactly.
Straighted and reflected.
Is it? Nowhere. There's a rectus femoris. You will mix those things, I know, but those are in for the rectus femoris and for the biceps femoris is a long head and short head, right? Now tell me what is the origin of the biceps femoris of long head?
I can't remember right now.
Okay, is there anyone who would like to help?
Actually,
Ischial tuberosity. Dr. Arnab, please continue. Dr. Arnab, please continue. From where the long head of biceps femoris originates?
Long ischial tuberosity.
Exactly, and the short head I mentioned in the class. Lateral to linea aspera.
Lateral to the
Whatever origin is not that much important. Main point is the insertion. Now tell me about the insertion of the long head of biceps femoris. What did it say?
Long head of biceps femoris inserted into the head of the fibula and partly in the lateral condyle of the
very
tibia.
good, very good. So what about the short head of biceps femoris insertion?
And the lateral condyle of the tibia.
Okay, very good. Now tell me what is number A?
Number A is semimembranosus.
And number B?
This semitendinosus.
Okay, now tell me what is the insertion of the semitendinosus?
Semitendinosus inserted into the anteromedial aspect of the proximal tibia.
Very good. And semimembranosus, insertion of semimembranosus?
Semimembranosus is merged with the oblique ligament of the popliteal fossa and some ligament of the popliteal fossa and
Okay.
meniscus.
Exactly, very good. Especially medial meniscus. And what is number E? What is number E?
Number E,
The popliteal fossa, you can
nerve.
see so many structures in the popliteal fossa. So what is number E?
So this is the superficial one, tibial nerve.
Exactly. How do you identify? These are the structures. So whenever you will get so many branches arise from a single structure, and that is nothing but nerve. You get my point where? So I got this station in my real exam in the Malaysia KL Center, and they asked every single thing I am asking you right now. One thing they have asked me, what about the nerve supply of the long head of biceps femoris and what is the nerve supply of the short head of biceps femoris? Tell me
Long head of
individually.
bicep femoris, long head of bicep femoris supplied by the tibial part of sciatic nerve, and short head of bicep femoris is supplied by the peroneal part of the sciatic nerve.
Exactly, exactly. So this thing you will be asked in your exam. So this is another picture. I think these are the same picture. So I have a quick revision. So now tell me what is number A? This is the medial portion, this is the
Number
lateral portion.
A
So what is
is
number A?
semitendinosus.
Very good. So
Semitendinosus.
what is number C?
This is the deeper one, tibial artery. Sorry, popliteal artery.
Exactly, popliteal artery, right? So tell me what is number B?
Popliteal vein.
What is number D?
Number D is long head of bicep, long head of bicep femoris.
Okay. What is number F?
Number F is a lateral head of gastrocnemius.
Okay. And what is number E?
This is the most short saphenous vein.
Short saphenous vein.
Saphenous vein.
Okay. Okay. That's good. Okay. Now I think you don't need this picture. You won't be shown this kind of picture in your real exam. But if you want to solve this picture, I can do like to solve this picture again.
Okay, where?
Okay. Now tell me what is this structure?
This is common peroneal nerve.
Okay. So now tell me the course of the common peroneal nerve.
Common peroneal nerve is divided into anterior, divided into superficial peroneal nerve, anterior and the anterior tibial nerve in the neck of the fibula, and supply the lateral compartment and the anterior compartment of the.
Is it called
leg.
anterior?
Deep peroneal, sorry, it's a deep peroneal.
Okay, so is the continuation of common peroneal nerve is the continuation of
continuation of sciatic nerve.
So just trace the common peroneal nerve from the sciatic nerve, because you will have one station foot drop in your examination. So and the patient will have patient will present as a the patient had an accident, fracture of the neck of the femur, or patient also had or patient had a fibula, sorry, had an venesection of or like varicose vein.
Varicose vein surgery.
Exactly. So this kind of presentation patient will have, and patient will have some scar on the lateral or the lateral aspect of head of the fibula. So your diagnosis would be foot drop. So you'll have to have a very clear conception regarding the common peroneal nerve. Now trace the common peroneal nerve from the sciatic nerve. Are you here?
May start from
yes,
yes. May start from the course of sciatic nerve.
Yes. Not needed from the thigh, back of the thigh. Just tell me the course of sciatic nerve from the back of the thigh.
Okay. In the upper 2/3 and lower 1/3, there is a sciatic nerve divided into two parts: common peroneal nerve and common peroneal nerve and a posterior tibial nerve. And the common peroneal nerve divided into two parts in the neck of the fibula. One is a deep peroneal nerve and one is superficial peroneal nerve. Superficial peroneal nerve supply the lateral compartment of the leg and the dorsum of the foot, except first rib space, and anterior. So and deep peroneal nerve supply the anterior compartment of the leg, and the sensory supply the first rib space.
Okay. Now tell me what is popliteal fossa? What is the boundary of popliteal fossa?
Popliteal fossa and the superior medially is the semimembranosus and semitendinosus, superior laterally by the long head and shorted of biceps femoris, and inferior medially by the medial head of gastrocnemius, and inferior lateral by the lateral of the gastrocnemius.
Okay, now tell me about the floor or popliteal fossa.
Floor is a plan. Floor is formed by the popliteal surface of the tibia.
Is it? Someone?
Sorry, it's a popliteal surface
Femur.
of the
Femur
femur.
and,
Sorry,
And any other ligament or
and
muscle?
upper
something
part
else?
of the tibia. Popliteus
And
muscle.
popliteus muscle.
Yes, popliteal surface of the femur, popliteal muscle, and posterior ligament of the knee joint. Right. Now tell me what are the content of the popliteal fossa?
From superficial to deep, common perineal nerve, tibial nerve, and popliteal vein and popliteal artery.
Okay. So I have a quick.
Sponsor vein.
I can also use, but he have mentioned the main one. So now quick revision. So what is number 1?
Number 1 is
the medial one and the lateral one. Okay, so which sided popliteal fossa is this at first?
Right sided.
Okay, why this is the right side? How would you identify?
Because common perineal nerve lies laterally and semitendinosus lies medially.
Very good, very good. So this is the only one you look for at first. So that will bring you the answer. So this is the biceps femoris, right? So what is number 2?
Common perineal nerve.
So what is number 3?
Number 3 is lateral of gastrocnemius.
Number 4?
It's the medial head of gastrocnemius.
Okay, number 11?
Semitendinosus.
Number 15?
Number 15, the tibial nerve.
And number 13?
Number 13 is the short saphenous vein.
Collapse one. And number 14?
Number 14 is the branch of, this is the sural nerve.
Exactly. So what is number 8 here?
Number 8 is
the deepest
artery,
one, right?
This is the artery.
Which artery? Femoral artery or something else?
Popliteal artery.
What is number 5? Dr. Alamin Bhai, what is number 5?
Gracilis.
Yes.
Gracilis.
Now it is gracilis. Whatever, you don't have to, you have mentioned every single thing here. Very good. Dr. Arnav, very good. So now come to this picture. Same thing again. So what is number 5?
Lateral head of gastrocnemius.
Very good. And number 6?
Medial head of gastrocnemius.
So if it is the gastrocnemius, so what is number 9? And it has been cut. What is number 19? Sorry. Soleus. So tell me about the calf muscle of leg.
Gastrocnemius, medial and lateral head of gastrocnemius, soleus, and plantaris.
Plantaris. So the course of the muscle where those muscle inserts?
All the muscle are inserted into the posterior surface of the calcaneus.
So what is the function?
The function is a plantar flexion.
And
plantar flexion of the ankle joint.
Okay, nerve supply of those muscle?
Tibial nerve.
Okay, that's great. You have covered every single thing. This deep structure won't be shown you in your exam. They will mostly cover the superficial. This picture is very important, and these are the very important picture. These are very important pictures. So have a screenshot, and I have mentioned that the posterior aspect regarding the anatomy, you will get 3 stations in your exam, and 1 station, and that is the head neck, and that is the compulsory station. You will get minimum 1 station from the head neck, and 2 other stations. About the 2 other stations, you will get 1 station from the upper limb or lower limb, but definitely from the upper limb or lower limb, but if you are lucky enough, you will get one from the upper limb and one from the lower limb, and lower limb is the most important than the upper limb. And regarding the lower limb, back of the lower limb is the most important. Whenever you will get any station from the lower limb, you can sure that the station from the back of the thigh or back of the leg. So these are very important. We have covered this one. Very good, Dr. Arnav. You did very well. So who was the next participant? I think Dr. Russell is here, who would like to participate. So guys who would like to participate in the mock, please raise your hand so that we can ask you. Dr. Russell, are you here, brother? Dr. Russell.
Assalamu alaikum.
Walaikum salam. Very good, bhaiya. Now tell me which bone this one? These are which bone?
These are the bone of TV and fibula of left side.
These are the bones of this one from the right side or left side?
This one is the right side, right?
So why
Yes,
did
right
you
side.
tell this is the left side? Now tell me why this is the right sided, not the left sided.
Because medial malleolus lies medially and lateral malleolus lies laterally,
Okay.
and tibial tuberosities lies anteriorly.
Okay, these are the point. You don't need to mention any other thing. So which side is this one?
This one also the right sided, and this is the posterior view.
So now tell me why this is the posterior.
Because there is a soleal line on the posterior on the tibial upper
Exactly,
end.
it's the most important one.
And tibia and fibula lies laterally.
And there's also fibular facet, right? This.
Lateral
Okay, no problem. So you have successfully done those things. So this is the back of the leg, and you do have this picture. So now tell me which sided ankle joint this one?
This one, the ankle joint of right side.
Right side. So tell me why this is the right sided or not the left sided? Tell me.
No, sorry. It is the left one because the middle malleolus lies above than the lateral one. So this is the left sided.
Okay, always remember by this way, medial malleolus will always lies superior. These are not in the same line. You will be definitely, if you are shown this picture in your exam, it would be very difficult to identify. But one thing you will have to mention, look for the malleolus. Look for the malleolus. Medial malleolus will always be higher than the lateral malleolus, right? Now, and you will get several structures behind the medial malleolus. So this is the medial malleolus. So you suppose you are not, you can identify what is it is medial or what is the lateral. Just look for the structures behind these bony prominences. So these are the more structures other than this one. So there's much more structure lies behind the medial malleolus. So this is the left sided, right? Now is it okay, Bhaiya? Now tell me, identify what is number 3?
Number 3 is the extensor hallucis longus.
Is it? So what are the compartments in the leg?
No.
So
Exactly.
just before that, now tell me what are the compartments of the leg?
There are 3 compartments in the leg: anterior compartment and posterior compartment and lateral compartment.
Now tell me how those compartments have been divided.
Posterior compartment again divided into 2, superficial and deep.
Now tell me how those compartments have been divided.
Okay, but the anterior and posterior compartment divided in between there is the interosseous membrane, and from fibula there is the anterior fibula and posterior fibular
anterior and posterior intermuscular septum, right?
Intermuscular septum that will cause the anterior and lateral portion. That will make the lateral portion actually.
Okay, now tell me the nerve supply of this. Now tell me the nerve supply of this compartment separately.
Okay, the lateral compartment is supplied by the superior peroneal nerve, and the
Superior?
anterior compartment is supplied by deep
Is it superior?
lateral peroneal nerve. Superficial and deep.
Russell.
Superficial peroneal nerve. Sorry.
Exactly. It's okay.
Superficial
It's
peroneal nerve, and then also anterior compartment is supplied by the deep peroneal nerve, and posterior compartment is supplied by tibial nerve.
okay. Now tell me how the posterior, how the muscles are arranged in the posterior compartment. What are the muscles that lies in the posterior compartment first?
Superficial compartment there lies gastrocnemius, soleus, and pectineus. And the
Pectineus?
deep compartment.
Is it pectineus, Dr. Russell? Just think before saying anything. Is it pectineus?
Plantaris, sorry.
Yes,
plantaris.
you know everything. I know it very well. You know everything, and you have passed so many exams in the first attempt. But those are written, I think. But this is verbal exam, so you'll have to much more cautious before saying anything. So this is the plantaris muscle.
And it is
so
like
tell
I
me what.
didn't get.
So what are the deep muscle of the posterior compartment of the leg?
Deep muscle of the leg there is posterior tibialis and flexor hallucis longus, flexor digitorum longus, and popliteus.
Okay. Okay. So if is it, then come to this picture right now. You told me these are flexor from the posterior. Before this thing you said is the extensor, right? Now tell me what is number 3. Is there anyone who would like to help Dr. Russell?
Flexor hallucis longus.
Flexor hallucis longus, right? Where? Now tell me, Dr. Russell, please continue. Insertion of this muscle. You'll be asked in your exam, definitely.
Flexor hallucis longus inserted into the distal phalanx of the first row, grade 2.
Great, right. So what is number 2?
Number 2 is medial to lateral. This is the flexor digitorum longus.
Very good. And number 13?
Number 3 is the tibial posterior tibialis.
Posterior tibialis. So what is
Tibialis
the
posterior.
Okay, what is the insertion of the number 2?
Number 2 is inserted into the distal phalanges of the lateral fourth row.
Okay, what is the insertion of the number 13? Tibialis posterior.
Tibialis posterior is inserted in the base of the first metatarsal bone.
Okay. So now tell me what are the muscles that lies anteriorly?
Anteriorly lies tibialis anterior and extensor hallucis longus, extensor digitorum longus, and peroneus tertius.
Okay, that's great. I will keep continuing preparation. You are doing well, but saying anything else, just think what are you going to say. So you're doing very well. So I would like to go Dr. Rajan. Dr. Rajan, are you here, brother? Hello, Dr. Rajan, are you here?
Yes, sir. Hello.
Yes, we can hear you. Are you here with us?
Yeah.
Okay, that's good.
Yes,
now,
sir.
now tell me what is number 11? Which bone is this? You don't have to mention the particular part of these bones, just identify this bone.
Tell us.
Does this? Tell us. Right. So what is number 13?
Calcaneum.
Okay. So what is number 15?
Navicular.
What is number 10?
medial medial cuneiform.
Okay, how many cuneiforms in the leg, in the foot? How many cuneiforms in the foot?
Three.
Okay, so could you tell me what is number 2?
Cuboid.
Okay, and what is number 20?
Head of fifth metatarsal.
Which metatarsal?
Fifth metatarsal.
Okay, so what is number 19?
Tarsal sinus.
Okay, that's good. Now come to this picture. Again, it's from the above and it's from the below. So tell me what is number 16?
Lateral cuneiform.
Okay. So what is number 14? 4, sorry, this is 4.
Calcaneum, sir, left calcaneum.
Okay, so which muscle inserts here?
Tendoachilles.
Okay, sorry, the function of the tender Achilles?
Tiptoeing.
I didn't get your answer there.
Plantar flexion of the foot.
Okay, now tell me how the ankle joint is formed.
Ankle joint is formed by the tibiotalar joint and tibiotalar and subtalar joint.
Okay, so which bone are responsible to form the ankle joint?
Tibia and talus.
Nothing else?
And calcaneum, I'm sorry, and anteriorly it is navicular.
Is there anyone who would like to help Dr. Raja?
Yes, sir.
Okay. Upper
Proclear
part
surface of
tibia and
talus.
fibula, and lower part is the talus.
Okay, okay. So Dr. Rajan, please tell me in which position ankle joint is more stable?
Dorsiflexion.
Dorsiflexion. Now tell me why it is more stable in dorsiflexion.
In the dorsiflexion, the most part of the talus is covered by the closed in the joint.
It's
So it is
not clear.
stabilized.
It's not clear for us. Is there anyone who would like to help Dr.
Okay, I will
Raja?
try.
Yes, Bhaiya, please continue.
The superior part of the talus,
Or
the wider part
superior part
present
is also known as superior part of talus is also known as. It's very pet question for the exam. So try to answer perfectly. Also known as superior part of talus is also known as trochlear surface of the talus, right? Now tell me.
Okay, trochlear surface is wider anteriorly. In dorsiflex position, the wider part fits very clearly with the lateral and medial malleolus, and there is no gap at all. So in this position, the movement is less, so stability is more. And oppositely, in the plantar flexion, there is a gap between medial malleolus and lateral malleolus, and less fit of trochlear surface of the talus.
Okay, it's okay. Now tell me what is subtalar joint. Dr. Rajan, tell me about the mid-tarsal joint or joint of Chopard. What are the joints in joint of Chopard or mid-tarsal joint? Dr. Rajan, are you here?
Yes, sir. Hello.
Yes.
Hello?
Yes, please continue. What is mid-tarsal joint or joint of Chopard?
Yeah, it is formed by the calcaneocuboid joint and the talocalcaneonavicular joint.
Okay, talocalcaneonavicular joint and calcaneocuboidal joint, right? So could you tell me which type of joint is calcaneocuboidal joint?
It is some saddle type of joint.
Okay, so this is the saddle type of joint. So could you tell me which type of joint is talocalcaneonavicular joint?
It is a ball and socket type of synovial joint.
Okay, that's great. Now tell me how the subtalar joint is formed.
It is formed by the lower end of the talus with calcaneum.
Okay, so what is the importance of the subtalar joint?
It helpful in the inversion and eversion of the foot.
Okay, now tell me what are the muscle responsible for inversion?
Inversion is maintained by tibialis anterior and tibialis posterior.
And any other muscle, any help from other muscles?
The help of extensor hallucis longus and flexor hallucis longus.
Very good. And which are the muscle responsible for eversion?
Eversion is peroneus longus and peroneus brevis.
Now come to this picture. So what is number 8?
Of the peroneus longus.
Okay. And what is number 4? This one? We have discussed this one.
That is calcaneofibular ligament.
Is it ligament or is any bony prominence? This is the bony prominence and there's a another bony. So that is lateral malleolus. Okay. So this is the peroneus longus. Now tell me what is number 7?
Is the peroneus brevis.
Okay. It's a most important question. Tell me the insertion of the peroneus longus, peroneus brevis, and peroneus tarsus. Now, by saying, I will look this picture. Now, tell me the insertion of the peroneus longus, peroneus brevis, and peroneus tarsus.
Peroneus brevis is inserted on the 31, sir. That 31, that base of the fifth metatarsal, peroneus brevis.
Is inserts here. Then
remaining
peroneus longus. About the peroneus longus, is there anyone who would like to help Dr. Rajan?
Peroneus longus inserted cuneiform, medial cuneiform, and first metatarsal, base of the first metatarsal.
Okay, that's great, Bhaiya. So could you tell me which muscle inserts here, just opposite to the peroneus longus?
Extensor hallucis longus. Flexor hallucis longus.
Is it, Bhaiya? So Dr. Russell, tell me where flexor hallucis longus inserts again?
Oh, sorry, sir. Eta kia hobe.
Is there anyone? Dr. Arnab, please try to give the floor. Dr. Arnab. Dr. Arnab, tell me insertion of the flexor hallucis longus.
Flexor hallucis longus inserted into the distal phalanx of the great toe.
Okay, that's good. This is the insertion. Now tell me insertion of the peroneus longus.
Peroneus longus inserted into medial lateral side of the medial cuneiform and
this portion
base of the first metatarsal.
Exactly.
Base of the first metatarsal.
Lateral of the first metatarsal, base of the first metatarsal. And just opposite portion, this portion is for insertion of tibialis anterior. Very good. So no, Bhaiya. No, Bhaiya. So this is the tibialis anterior. This is the flexor hallucis longus. This is the flexor. This is the flexor hallucis longus, and this is for peroneus longus. And someone tell me insertion of the tibialis posterior. Where tibialis posterior inserts? I discussed yesterday.
Tibialis posterior inserted into the navicular bone and medial cuneiform.
Very good. Very good. This one. So I think all of you got your answer from here. Is it okay, Dr. Rajan? Did you get my point, Bhaiya? Brother, did you get my point? Did you get my point? Okay, I think it would be easier. I don't need to go through. Now come to this question. Dr. Rajan, are you here with me?
Yes, sir.
Yes, yes, yes. Okay. Now come to this picture and now tell me what is number D.
Number is medial cuneiform.
Mhm.
Left medial cuneiform.
Okay. What is number B?
Left intermediate cuneiform.
What is number C?
Is left navicular.
Now tell me the anteriotibial artery. How would you palpate the anteriotibial artery and the course of the anteriotibial artery?
Anterior tibial artery that erases. Sir, are you asking about anterior tibial artery?
Yes, yes. About anteriotibial artery. Tell me the course of the anteriotibial artery.
Okay.
From where it is originates, how it goes, and where we'll palpate about the artery dorsalis pedis and the course of the artery dorsalis pedis. Tell me.
Anterior tibial artery that arises from the femoral artery at the level of the knee joint.
Is it? So what about the popliteal artery? So what about the popliteal artery?
Yes, sorry. Anterior tibial artery from the popliteal artery in the popliteal fossa. And then it continues distally as the dorsalis pedis artery. Usually the popliteal artery that divides at the distal border of the popliteus muscle into two things: tibio-peroneal trunk and anterior tibial artery. And then this anterior tibial artery passes. Hello.
Please continue.
Yeah, it passes through the interosseous membrane, and then it is present lateral to the tibialis anterior, and then it passes in front of the ankle joint and continues as a dorsalis pedis artery into the dorsum of the foot, lateral to the tendon of extrahalsis longus, and medial to the extensor digitorum longus. You can palpate it on the first metatarsal base, lateral to the first metatarsal base.
Okay, against the navicular bone, right? It goes against the, I will palpate against the navicular bone, and it goes lateral to the extensor hallucis longus, because extensor hallucis longus this way, comes this way, and is the dorsal interstia, it goes to the sole of the foot, right? That's okay. So just read this X-ray. What is this?
It is right foot fifth metatarsal base. That is Jones fracture.
Right foot fifth metatarsal base fracture, right? So which fracture is this? It is known as Jones fracture. Jones fracture. Okay, now tell me what are the muscles inserts this portion?
That is peroneus brevis that inserts from the.
Only the peroneal brevis? Only the peroneal brevis, or any other muscle? All of you guys are silent today. I don't know why. Please raise your Please raise your hand so that I can go you and I can shuffle you and I can choose you individually or randomly. Please raise your hand so that I would know that you are wishing to join this mock, so I can ask you the question. Otherwise, it would be really difficult to ask you the question individually. Some are prepared, some are not prepared. That's okay. We are not here to criticize you. We are just to make your preparation perfect. So just raise your hand so that I can ask you the questions. No problem, please. So this is the Jones fracture and two muscle inserts here. One is peroneus brevis and another one is peroneus tarsus. Okay, so could you tell me which nerve supplies the peroneus tarsus?
And that is deep peroneal nerve.
Okay, deep peroneal nerve. That's very good. That's very good. Okay, I think you did very well. And if you want to allow me to keep asking the question, then I can ask you another thing. Are you, do you like to continue?
Please, sir. Please.
Yes. So
Yes,
now
sir.
tell me what are the arches of the foot? What are the arches of the foot?
Medial longitudinal arch and lateral longitudinal arch and transverse.
Okay. Now tell me what are the bones responsible to produce the lateral longitudinal arch?
Lateral longitudinal arch, like the bones are calcaneum, cuboid, and two lateral metatarsals.
Okay. So which are the ligaments responsible for maintaining the lateral longitudinal arch? Ligaments?
Ligaments are short plantar ligament and plantar aponeurosis.
Mm-hmm. And the common one which is present in 3 compartment arches? Interosseous ligaments. Exactly. So what are the muscles to produce the lateral longitudinal arch?
Peroneus longus and peroneus brevis.
All the 3 peroneus, not that only 2. All the 3 peroneus and short muscles of the little toe. That's okay. Now tell me the last question. This is the last question for you. What is the function of the lateral longitudinal arch?
Mainly it transmits the whole body weight.
Exactly. The whole body weight transmission. Very good, Dr. Rajan. You did really well and keep practicing like this way. I think if you could attend the class, your preparation would be much more easier and clear. That's great. So I would like to go Dr. Badhan again. Badhan Apu, are you here?
Yes, Bhaiya.
Okay. So tell me which are the structure that goes behind the medial malleolus?
Structure that goes behind the medial malleolus. Okay. These are tibialis posterior, then flexor digitorum longus, then which posterior tibial vessels, then posterior tibial nerve, then that's posterior flexor hallucis longus.
Okay. So which are the structure that goes behind the lateral malleolus?
Behind the lateral malleolus is peroneus longus and peroneus brevis.
Okay. Okay, that's good. So nerve supply of the peroneus longus and peroneus brevis.
A nerve supply is a superficial peroneal nerve.
Okay. And the function of the peroneus longus?
Function is eversion of foot at subtalar joint.
Okay. Okay, that's good. Now come to one of the most important topic for the exam. This is the ligaments. So could you tell me what are the parts of the deltoid ligament?
Okay. So the parts of the deltoid ligament are anterior interior talocalcaneal ligament, posterior talocalcaneal ligament.
It is talocalcaneal or something else?
No.
Is talocalcaneal or something else?
Tibiotalar.
Yes,
Posterior tibiotalar.
anterior tibiotalar, posterior tibiotalar, talocalcaneal, and then another one is sorry, I just messed up the deltoid. I messed up deltoid.
There's a 4 part, right? Deltoid ligament has deltoid 4 parts. One is anterior anterior tibio-talar joint, and fourth one is posterior tibio-talar joint, and in between them one is anteriorly navicular bear, and behind the navicular that is the calcaneal, tibio-calcaneal. So there's 4 ligaments. 4 ligaments. Okay, Dr. Badhan. Okay, Apu?
Okay.
4 ligaments. Just have a look here. Have a look here. The four ligaments lies medially. This portion lies medially. This is the talus, this is the calcaneum. So anteriorly tibio-talar, tibia and the tibio-talar ligament, anterior-tibio-talar ligament, posterior-tibio-talar ligament, tibio-calcaneal ligament, and tibio-navicular ligament. Sorry. So these are the 4 ligaments. Now tell me what are the ligaments lies laterally?
Laterally lies the anterior tibiofibular ligament, posterior tibiofibular ligament. Sorry, no, that's anterior
I think you have messed up
talofibular
the.
ligament, posterior.
Yes.
Yes,
It's okay.
bhaiya,
It's okay.
I have missed the two
Calcaneofibular
sides.
ligament,
Okay, that's
anterior talofibular, posterior talofibular.
okay, sister. There's a easy way to remember. Always remember which malleolus, which bone is larger, tibia or fibula.
Tibia is larger.
Okay, so the ligaments that are attached with the tibia, those name starts with the tibia. So larger bones or ligaments that are attached with the tibia, those name of the ligaments starts with the tibia, like anterior tibio-talar joint, anterior posterior tibio-talar joint, tibio-navicular joint, tibio-calcaneal joint. These are the name of this ligament starts with the tibia, and the fibula is smaller. That's why the name of the ligament that attached to the fibula that starts with the other bone, like when the ligament it attaches between the talus and fibula. So fibula is smaller one. That's why the name will start with the talus. That's a talofibular ligament. Anterior talofibular ligament, posterior talofibular ligament, calcaneofibular ligament. Did you get my point, sister?
Yes, bhaiya. Yes, now it's very easy, bhaiya. Now
I
I can
think
remember. Thank you, bhaiya.
by this way it would be easier for you. Everyone, did you get my point?
This way I also meant.
Yeah.
Okay, I think that would be easier for you right now. So come to this picture first. Dr. Badhan, please continue. What is number 6?
6 is deltoid ligament.
Which bone is this?
This is medial, so this is a navicular bone.
Okay, very good. And specifically, this is the tuberosity of the navicular bone. Okay, which ligament is this?
And this is spring ligament.
Spring ligament or calcaneonavicular ligament, right? Now tell me what is number 15?
15 is the tibia.
And what is number 14?
Medial malleolus of tibia.
Okay,
14 is a
malleolus.
long plantar ligament.
Okay, so the structure that deep to this 14, and that is the
short plantar ligament.
okay, very good. Now come to this picture. Number D. What is number 3? Now tell me what is number 13 at first? What is number 13?
13 is a lateral malleolus.
Okay, very good. So what is number 3? Now is your exam. Lateral malleolus, and lateral malleolus is a part of fibula. So now the name of this ligament will start with the fibula or any other bone?
Other bone.
Exactly. Now tell me what is
so
number
that's
3?
the calcaneofibular ligament.
Very good, very good. Now tell me what is number 1?
1 is anterior talofibular ligament.
Okay, excellent performance. Now tell me what is number 14?
Number 14 is a long plantar ligament.
Okay, and now what is number 2?
Number 2 is this is a calcaneonavicular ligament.
And I said it has 2 parts, and by this way it is known as bifurcate ligament,
Okay,
right?
bifurcate ligament.
Okay. Now tell me which sided ankle joint this one at first.
Okay, so the medial malleolus is higher, so that side. Okay, this is the left-sided.
Okay, I think you have answered enough questions. That's great. Keep preparing. I would like to go Dr. Dr. Mehdi Hassan Bhaiya, do you like to participate the mock? Please, if you would like to participate the mock, please raise your hand, please. I asked you guys several times, please raise your hand if you like to participate in the mock. This session is very, very important. And if you have lowering in your exam, yes, no problem, no problem. If you are not well prepared, but still would like to participate, that's okay. We'll help you definitely, no problem. But if you are not interested to join, no problem. We'll skip you. So, do you want to participate, or I'll go to Dr. Riaz?
Okay. Yes.
Okay. Okay. Let's continue. Okay. Now tell me, which sided ankle joint this one?
This is less angle joint because the medial malleus is high.
Exactly. Is a higher one, right? So now tell me, what is number 8? Yeah. Which part of which bone is this, and which part?
Number 8 is lateral malleus.
Number 9.
Number 9 is medial malleus.
Okay. So what is number 20? This is the tibia and this is the fibula, and in between them, this is. Is there anyone who would like to help?
Posterior tibiofibular ligament.
Exactly. Posterior tibiofibular ligament. And deep to this ligament, what is number 12?
This is inferior transverse ligament.
Very good, very good, very good. Now, which bone is this? Number 10?
Talus.
Okay, okay, okay. Dr. Riaz bhai, please continue. Dr. Mehdi Hassan bhai, please continue. The talus. And there's a one ligament that is 19 that is attached with this structure. So what is 19?
Posterior.
Yes, yes. This is the posterior talofibular ligament. So look at this structure. So what is 23? Which bone? This one.
23 is calcaneus.
So a ligament that attaches with this one and this one. So what is number 3?
Yeah, calcaneofibular ligament.
Number 3 is calcaneofibular ligament. That's okay. I think we have covered every single thing here. So this is the same picture. I have a screenshot, and this ankle very commonly comes in your exam. So practice by yourself. This one. Who is this? Who is this?
Pinto.
Pinto, please continue. Bhaiya.
In case of right or left, medial malleolus is always higher. Is it the differentiating point in right or left?
You are the orthopedician, so it's your platform to say how would differentiate in the right and left. So I think is the easiest one, because medial malleus is the higher one and lateral malleus is the lower one. Is one thing, and another one is the talus. This lies mostly medially. So if you want, then you don't need to. But this is the main differentiation point.
This is the similar in both right or left.
Mm-hmm.
Right and left. This is similar. Medial malleolus is always higher.
Exactly, always higher, and that will lie medially. Yes, yes. Medial malleolus will be higher, and that will lie medially. So if this structure, this is the medial malleolus, and this is the lateral malleolus. And another picture, this is the lateral malleolus, and this is the medial malleolus. So tell me, which sided ankle this one, and which sided ankle this one? So which sided this one?
Upper one is right side.
Yes, this is the right. This is the right sided. Now tell me why this is the right sided.
Medial malleolus is high.
Exactly. So, and which sided is this, Dr. Pinto?
Left one.
So why this is the left sided?
In this picture, it is I think it's difficult.
No, it's not difficult. I have shown. I
think if you see the picture from the posterior,
same formula.
Posterior view, the Then we differentiating this.
Yes,
Maybe.
the from different posteriorly. That's why. Okay, I
That's
think
the main difference.
yes, I think you got your answer. Now I would like to continue with Dr. who was the Riyaz Bhai. Are you here, Dr. Riyaz Bhai?
Yes.
So it's your station. Now tell me what is number 17.
Tibialis anterior.
Okay, now tell me what is the insertion of the tibialis anterior. We have discussed already.
Base of first metatarsal and medial cuneiform.
Okay, that's good. Now tell me the function of the tibialis anterior.
Tibialis anterior dorsiflexion and eversion of the foot. Inversion of the foot.
Inversion. So
inversion of the foot.
Which other muscle will help you to invert your ankle joint?
Tibialis posterior.
Okay, so inversion occurs in which joint?
Subtalar joint.
This is the way you will be asked this type of questions in your real exam. So which nerve supplies the tibialis, this muscle?
Deep peroneal nerve.
Okay, now tell me what will happen if deep peroneal nerve is injured?
Both motor and sensory will be lost. Sensory loss in the first YB space in the dorsum of the foot, and in case of motor, there is no plantar flexion.
So if there is no plantar flexion, what will happen?
Dorsiflexion occurs and no inversion of the foot occurs.
So there is a foot drop.
Foot drop.
Okay, that's great. So try to answer this way. So now tell me what is number 7?
Extensor hallucis longus.
So what is number 3?
Arteria dorsalis pedis.
Okay. So what is number 6?
Is the
longest? So what will happen?
brevis.
Okay.
Extensor hallucis brevis.
Okay, so what is number this one? This 5.
Extensor digitorum longus.
Okay, so what is number 4 along with the 5?
Interosseous muscle.
Is it number 4? Is it muscle or tendon?
Tendon.
So what is the tendon of this one?
Extensor digitorum brevis tendons.
Okay, so now tell me what is number 12?
Peroneus tarsius.
So peroneus tarsius belongs to which compartment of the leg?
Anterior compartment.
So tell me the nerve supply of the peroneus tarsius.
Deep peroneal nerve.
Okay, that's great. Now come to this picture. So what is number 3?
Number 3 is plantar ligament, long plantar ligament.
Long plantar ligament. So which ligament is situated just deep to this ligament?
Short plantar ligament and plantar ligament.
Okay. Now tell me what is number 2? Just what is this? Medial malleolus or lateral malleolus? Which sided? What do you think?
Lateral malleolus.
Is it? So tell me which bone is this?
Sorry. It's a fibula, medial malleolus. Flexor.
So this is the muscle.
Longus. Flexor hallucis longus.
Longus. Flexor hallucis longus. So which muscle is this? So now tell me how.
Longus.
So there is, now tell me what are the structures that comes behind the medial malleolus?
medial malleolus, flexor digitorum longus, tibialis posterior, flexor hallucis longus, flexor digitorum longus, posterior nerve, posterior artery,
Okay,
and
okay,
vein.
whatever. Okay, you have mentioned about the three muscles. So particularly why this is the flexor hallucis longus? Tell me, how did you identify the flexor hallucis longus? Flexor hallucis longus.
This is lies laterally.
Is it the only answer? So what did I
And
say in the class? How would you identify the muscle? By seeing the origin or insertion?
origin and insertion.
Okay, so tell me where this muscle inserts. What is the inserting point of the flexor hallucis longus? Someone please help Dr. Riaz bhai.
Distal phalanx of great toe.
Okay, this very good. So what's the function of this muscle?
Plantar flexion
Of
Flexion of
foot.
great toe.
Okay.
Great toe.
Flexion of the great toe, plantar flexions.
Okay. Riaz bhai,
Inversion.
tell me what is number 6? This one.
6.
Peroneus longus.
Peroneus brevis longus.
Is it babies?
Peroneus longus. Peroneus longus.
So tell me what is number 5?
Peroneus brevis.
Okay, so why did you say this is the peroneus brevis and is the peroneus longus?
Peroneus brevis lies superficial and insert into the base of the fifth metatarsal, and longus insert in the first metatarsal and medial cuneiform after crossing the foot.
Okay. So I think you have covered every single thing here. It's very important. Okay, now tell me the skin innervated by peripheral nerve by seeing this structure. Now tell me which nerve supplies this area.
Saphenous nerve.
Okay, so this is the saphenous nerve. So which nerve supplies this area, lateral portion?
Sural nerve.
Sural nerve. So which nerve supplies this portion?
Superficial peroneal nerve.
Superficial peroneal nerve. And in between this portion, this is
Deep peroneal nerve.
Deep peroneal or fibular nerve. That's great. You did very well all over the questions. So I think we had 30 slides here. I think we have covered every single thing. Especially I brought so many new pictures for this mock today. And if you go through this picture, I think that would be enough for you for passing the exam undoubtedly. And we have covered every single thing. And all of you know that we are running a course, and all the participants of this course, because we promised to allow only the enrolled doctors to participate in our mock session. So all the doctors who are participating today, those are our enrolled doctors. And we are because one thing that we have started our course just 2 months later, March, in the first week of the March, and that's why most of the candidates have enrolled any other places. So all the course students in our batch, most of them those are our previous students of MRCS Part A exam. So recently we have this course, and we have started this course. We have finished the critical care and anatomy is going on. So we have declared to have a discount session, and huge discounts is going on. So if there anyone who would like to join in our course, you are highly appreciated. And I always used to say money won't be a barrier. If you want to help from us, just you are free to ask the help, nothing else. So is there any suggestion who would like to say anything? Anyone who would like to say anything?
In Friday, ASCC grand mock will happen or not?
Yes, definitely. We have discussed, we have declared you that we are going to arrange a offline mock session in the Friday, and venue have been selected, and this is one of the hospital in Green Road, and this is the final. And the mock session will be continued from 9 a.m. to almost 6 or 7 p.m. for long to 12 or 11 hours. So if you want to complete your ACC syllabus in a single day, 41 stations in a day, and participate the whole mock session, you are free to join and free to access. That's all, Bhaiya. Is there anyone who would like to say anything, Dr. Dr. Rajan, Dr. Alawin Bhai, anyone? Dr. Mehdi Bhai?
Yes, sir. Yes, I want to ask you something.